Namaste, good morning, and welcome to Times Health Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. Today, we are going to discuss about one of the most important topics that we haven't covered by now, and which is always sought after. Okay, so many people have asked to take this topic, and hence we are going to discuss more about how to improve the digestion and immunity. So, basically, how to take care of your core area, that is your abdomen. Okay, so we are going to discuss more in detail about it. Today, we are going to divide this section into two parts. First part is just understanding how to maintain a better gut health, and the second part will include all the asanas that are required, all the asanas that are required to activate the core area and to maintain a good abdominal health. All right, so let's get started with it. So first, just discussing about how to maintain a better gut health. So there are multiple factors that are important whenever you are talking about gut health. Okay, so if you see, the gut is very closely related to our brain. How? I'll give you a simple example. Whenever we feel anxious, okay, the first thing that we get is butterflies in our stomach. Okay, so you can see how closely it is related to the brain, and indirectly whenever you are not in a good gut health. Okay, so whenever there is any kind of gut issue, we cannot stay very happy. Okay, the brain feels kind of depressed, it doesn't feel very active. Okay, so these are the things that happen. So you see how closely the gut and the brain are related to each other. Also, our gut is major center of lot of immune cells. Okay, so there are a lot of immune cells that are present in the gut. So you see how important it is to maintain the gut health. Okay, so because immunity is also influenced by the health that is present in our gut. Okay, so that's very, very important. The third thing is, if the abdominal shape and structure is well maintained and the core is strong enough, then it supports your spine very well, because it is the central area of the body. It has to be strong so that it can maintain the strength of the other joints, because all other joints are connected to it. It is axial in nature, that means central in nature, and all the joints are connected to it. So if your center is strong, flexible, then automatically the other joints will be in good health. Okay, so these are some of the things that are very, very important that we need to know, and that's why gut health becomes utmost important. But if you can understand, gut health is multifactorial in nature. Okay, there are many factors that influence the gut health. Okay, I'll give you some of these factors, and we are going to just target one of these factors through the asanas. Okay, so the first thing is that food and nutrition. I'm sure you know that food and nutrition highly influence the gut. Okay, because all our food gets processed through the digestive tract. So it's very important to choose proper food and nutrition whenever you want to talk about gut health. Okay, so it's very, very important to ascertain that. The second thing that is very important is adequate sleep. Okay, so if you do not have adequate sleep, there may be some disturbances in the abdominal health or the digestive system. Okay, so adequate sleep or relaxation is very, very important. Whenever we are talking about gut health, that balance is very important. What kind of balance I'm talking about? The balance between activity and rest. Okay, so if there is not adequate balance between activity and rest, then your gut health will get affected. Okay, so that's very, very important to maintain an adequate balance. If you're doing too much activity and not enough rest, that can also influence your digestive tract. If you're doing too much of rest and not enough activity, that can again influence the digestive tract. And that's why the right kind of balance is very, very important. Okay, so that's the next thing. So adequate sleep or rest, and then exercising regularly is very, very important. Okay, the next thing that is important is what kind of medications you are taking. Okay, because if you're taking any oral medications, it's very, very important that you know that there are many medicines that may have some side effects, and hence doctors always give you medicines that are aligned with it. So it's very, very important to complete the full course of medicines that is prescribed by the doctors, okay, because they can influence your digestive tract. So these are some of the important factors which can influence the digestive tract. And from this, we are going to tackle one of them, that is how to maintain adequate exercise, what is going to target the abdominal area. Okay, so exercises and asanas that are going to target the abdominal area, and how to rest it out adequately, or how to give it enough relaxation. So we are going to make sure that we target the vagus nerve, which is going to directly influence the digestive tract. Okay, so yeah. So now let's go on to let's understand what are the asanas that we are going to do that is going to directly target the abdominal area. So we are going to start with the asanas, but just before going that, let me read some comments. Okay. Good morning, Ganesh ji. Padma ji, I have wrist joint pain. I feel burning sensation in my wrist joint along with pain. It's like decurvance. Okay, so Padmaji, what kind of occupation do you do, or what kind of activities are there on a regular basis? If you have decurvance, we need to figure that out and probably modify that. Okay, first, if you have pain, then you need to do something to subside the inflammation if it is decurvance. Okay, so something to subside the inflammation needs to be done, probably like icing or a contrast bath would be helpful. Plus we need to see if there is something which is constantly causing micro trauma to your tissues, and we need to deal with that. Okay, so we need to know what kind of activities you are doing on a daily basis, and probably reduce or modify that, so that the inflammation is not continued. Okay, so these are two things that we need to start with. Along with that, some exercises for the wrist and hand will be helpful, okay, if you want to deal with this. But we need to exactly figure out what are the common activities that you're doing, and then we can probably go ahead and discuss more about it. All right, so let's start with the asanas that are going to target the core area. All right, and we will start first with conditioning practice. So in the sitting position itself, we are going to condition. The first thing that we do is, maybe you can cross your legs, or if you are sitting on a chair, you can sit with your legs, the feet touching the ground. Keep your back absolutely erect. Now, why do I say back erect? I'll tell you. Simply keeping the back erect can activate your core well. Okay, so it's very, very important to keep your back erect. Okay, so keep your back absolutely erect. Your eyes should be focused at one point in front of you. Okay, so gaze at one point in front of you. Keep your hands on your thighs. You can keep your palms facing down or up as you're comfortable. And slowly you can close your eyes. Now, slowly bring all your attention to your body and your breath. We are trying to calm our mind and bring all the attention to assess our body and our breath. Try to observe your back, your abdominal area, your legs, your arms. Try to observe everything. How is it placed? How are you feeling in different areas of the body? Now, slowly open your eyes and relax. We are going to start with the conditioning practice. Okay, so first thing is through the neck. So let's do the neck movements first. Okay, so some warm up, look up and down. 2, 3, 4, 5, 6, 7. Now turn your neck towards either sides, towards the right side and the left side. 1, 2, 3, 4, 5, 6, 7. Now tilt your head towards either side. So 1, 2, 3, 4. Make sure you're not turning the head when you're doing this. 5. It should go straight to the side. 6, 7. Many a times I have seen people turn their head and then take it to the sides. That's not the right way. You need to go straight sideways, okay? So that you feel some stretch on the opposite side muscles, okay? So this is about the neck. Now let's stretch the shoulders a little bit. We're going to clench our hands, fingers, and then slowly stretch your hands up straight. Stay there. 1, 2, 3, 4, 5, and slowly relax. Once again, fingers interlocked. Stretch your hands up. 2, 2, 3, 4, 5. Relax. Again, stretch your hands up. 3, 2, 3, 4, 5. Relax. Again, stretch up. 4, 2, 3, 4, 5. Relax. So as you're stretching your hands up, you're also trying to elongate your spine. 5, 2, 3, 4, 5. Relax. 2 more times. Stretch. 6, 2, 3, 4, 5. Relax. One more time. 7, 2, 3, 4, 5. Relax. Okay, so the next one is we're going to move our wrists. So you can probably make a fist and just turn your wrist around. 1, 2, make full circles of the wrist. 3, 4, 5, 6, 7. Move it in the opposite direction. 1, 2, 3, 4, 5, 6, 7. All right, now let's go on to rotating or twisting our spine. You can hold your hands in front and just twist to either sides. 1, come center to the other side. Come back to the center. Again, 2, as much as you can comfortably. 3, 4, 5, 6, 7. Okay, and relax. Now we're going to move our hips. So just straighten your legs and slowly bend one hip at a time. Relax, straighten, bend other hip, straighten. 2, as much as you can. 3, bring it close to your body. 4, 5, 6, 7, All right, now we're going to move our ankles. So we're going to turn it around clockwise and anti-clockwise. 2, 3, 4, 5, 6, 7. Another way around. 1, 2, 3, 4, 5, 6, 7. Okay, we're just going to curl our toes and extend them. 2, 3, 4, 5, 6, 7. All right. Now, what we are going to do is we're going to stand and start with our asana practice. All right. So, what we are going to do is now just understand we are working on activating our core muscles, targeting our abdominal area. Okay. So, any asana which is going to challenge our balance is actually indirectly going to activate our core. Normally, our core gets activated as soon as we are initiating any activity. Okay. The more challenging that activity, there is a definite activation of the core muscles. Okay, so something like a single leg balance would automatically tend to activate the core. Okay, but in some people the core is so much inhibited that it might not get activated. In such cases the balance will also be seen to be little affected because of that. Okay, so we need to make sure that we are practicing balancing asanas on a regular basis so that the core remains activated. So the first asana that we're going to do is Ekpadasana. Okay, so let's start with it. What we're going to do is we're going to stand on one leg, take the other leg up, try to keep it on the inner thigh, hold that position, okay, and join your hands in front of your chest. Stay there. 1, 2, 3, 4, 5, 6, and slowly relax. Okay, do it on the other side. Same thing, stand on one leg, keep your other foot on the inner thigh. Okay, join your hands and stay there. 1, 2, 3, 4, 5, 6. And slowly relax. Any asana which is going to be a single leg balance is going to activate the core. In case if you feel the balance is not adequate, initially you can take support of the wall and then do the asana. Okay, so you can probably stand against the wall or place one hand against the wall and then perform the asana with little wall support. Okay, stay there. Keep your back erect, keep activated, abdomen tucked in slightly, and 1, 2, 3, 4, 5, 6, and slowly relax. And on the other side, same thing. Okay, keep your leg on the inner thigh. Everything is active and join your hands up. 1, 2, 3, 4, 5, 6. And slowly relax and release. Okay, if you are, so take minimal wall support. If you are not even able to balance with that, you can take more wall support. That means absolutely touch the back to the wall and then perform this asana. That's fine. Okay, slowly and steadily you can remove the wall support. Okay, and this will also help you align your leg as much as possible towards the wall and stay there. 1, 2, 3, 4, 5, 6, and slowly relax. And on the other side, back erect. Okay, push your knee behind as much as possible and stay there. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, so this was Ekpadasana for you. The next one that we are going to do is a side bend, because generally what happens whenever we are talking about the abdomen, we generally focus on the front and the back, but we forget the sides. Okay, so it's very important to also work out on the sides. So this one, we're going to keep our legs together. We are going to clench our hands up And slowly just bend sideways. Okay, stay there. 1, 2, 3, 4, 5, 6. Come back to the center. Okay, bend to the other side. Stay there. 1, 2, 3, 4, 5, 6. Come back to the center and relax. Okay, if you're doing it properly, you will feel some activation on the sides. Okay, so that means that it is appropriate. You do not need to push your waist to the side. So while doing this practice, do not push your waist to the side. Keep it in the center, fixed and stable, and just try to bend from the upper body as much as you can. And stay there. 2, 2, 3, 4, 5, 6. Come back to the center and bend to the other side. 2, 2, 3, 4, 5, 6. Come back to the center and relax. All right, so this is about it. If you feel that you are not able to balance enough, you can keep about a 1 foot distance between the feet and then do the same posture again. Okay, so bend sideways. This is going to be a little easier and stay there. 1, 2, 3, 4, 5, 6. Come back to the center and to the other side. 1, 2, 3, 4, 5, 6. Come back to the center and relax. Okay, so this was about activating the sides. Okay, there is one more asana which is going to work on the sides. That's Trikonasana too. So over here, we are going to take about 3 foot distance between the feet. Turn 1 foot outside and the other foot about 45 degrees inside. Okay. Now what we are going to do is we are going to raise both our hands to the shoulder level and slowly bend sideways as much as you can. Okay, and stay there. 1, 2, 3, 4, 5, 6. Slowly come back to the center. Turn the other foot out and put this one, right one 45 degrees in. And again, bend sideways and stay there. 1, 2, 3, 4, 5, 6. Come back to the center and relax. Now, let me explain the mechanics of this movement. Okay. If you have had any abdominal surgery, if you have had hernia, okay, you're not supposed to do this asana. Any spinal surgery or severe slip disc, please do not perform this asana. Okay, now let's see how we are supposed to go and come back. Okay, so now we are going to keep our hands at the shoulder level, and if you see, I'm going to bend sideways and not forward. Okay, so it's absolute sideways movement. Okay, at the end of the movement, you might feel some stretch on the inner thigh as well as on the side of the waist. Stay there. 1, 2, 3, 4, 5, 6. Now, when you are coming back, try to engage the side of your waist and your hip, and then try to come back to the neutral position. Use your muscles when you are going down as well as coming back. Okay, turn your other foot out. Go down. Stay there. 1, 2, 3, 4, 5, 6. And slowly come back to the starting position and relax. Now, along with this, the breathing becomes utmost important. Since we are doing a deep lateral bend, we are going to exhale while going down and inhale while coming up. Okay, and in between, normal breathing. So let's perform this asana once again. Keep your hands at the shoulder level. Inhale at the place. Exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, so this was for working out the sides of the abdomen. Okay, so you cannot miss on the sides if you're working on the front and the back. Now let's do the next one, that is Utkatasana. Okay, anything like in the form of sit-up is going to again encourage the core contraction, provided you keep your back erect. Okay, if you're leaning forward, then the core contraction is not that efficient. Okay, so let's see how to do the Utkatasana. We keep 1 foot distance between our feet. Come up on our toes. Take the hands at the shoulder level. Slowly bend down and sit as much as possible. Stay there. 1, 2, 3, 4, 5, 6. Now push yourself up straight and stay there. 1, 2, 3, 4, 5, 6. Then slowly go down, relax. Okay, now this type of movement coming up from the ground is going to activate the core a lot. But if you are coming up by leaning forward, I'll show you how, then the core is not that activated. Okay, so let's see how. Go up on your toes, go down straight, stay there. 1, 2, 3, 4, 5, 6. Now trying to lean forward and then get up, this kind of movement, okay, it's not going to encourage a lot of core contraction. Okay, so we need to make sure that we are getting up straight. All right, so let's just perform this asana with breathing and proper alignment. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there with normal breathing. 2, 3, 4, 5, 6. Inhale, come up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, the more you do it with count and rhythm, the better it is for the muscles to work adequately. Okay, let's perform this asana once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right, so this was Utkatasana. Okay, very effective for core activation. Next that we are going to do is Surya Namaskar. We'll do 2 rounds of Surya Namaskar and see how it is working. It works really well on the abdominal area because there is a lot of forward and backward bend. All right, so let's do it. You have to come in front of the mat. Keep your legs together. Now inhaling. 1, 2, 3. Exhale. 1, 2, 3. Now slowly take one leg behind, one leg, keep one leg forward. 1, 2, 3. Now slowly go back with the other leg. 1, 2, 3. Now knee down, chest down, chin down. Now slowly move into Bhujangasana. 1, 2, 3. Move back into Adho Mukha Svanasana. 1, 2, 3. Take the other leg forward. 1, 2, 3. Take the other leg forward. 1, 2, 3. Slowly move back into extension. 1, 2, 3. And slowly move into Sthit Prarthanasana again. Okay, so this was half the round. Now let's proceed with the other half. 1, 2, 3. Bend forward. 1, 2, 3. Now the left leg forward, right leg behind. 1, 2, 3. Adho Muksha Anasan. 1, 2, 3. Ashtang Namaskar. 1, 2, 3. Bhujangasana. 1, 2, 3. Going to Adho Muksha Anasan again. 1, 2, 3. Now right leg forward, left leg behind. 1, 2, 3. Go bend forward, Hastpadasana. 1, 2, 3. Astuttanasana. 1, 2, 3. And slowly Sthit Pradhanasana. Okay, there's a lot of heat generated within the body. It's going to really help with managing the metabolic rate of the body as well as the immune system. Okay, so very effective asana for the abdominal health. Okay, let's start once again one more round of Surya Namaskar, this time with the breathing coordination. All right, so join your feet together. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale and exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, so I hope you got it. Now we'll do the other half. Let's see how to do it. Join your hands in front of your chest. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. Left foot forward, right foot behind. 1, 2, 3. Exhale. 1, 2, 3. Inhale and exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right. So the more you try to do with rhythm and with counting, the better it gets for the muscles to move smoothly in contraction and relaxation. Okay. So Surya Namaskar, very effective for core activation, and a lot of control is required in the transition from one movement to the other. Now let's go on to one last asana in standing, that is Malasana, because without Malasana, I think anything to the digestive tract is incomplete. Okay, so we take about 2.5 foot distance. Turn the foot about 45 degrees outside, both the feet facing outside. Now slowly squat down completely and try to push our elbows outside and our palms placed in Namaste position. Stay there. 1, 2, 3, 4, 5, 6. Now slowly push yourself up straight. Okay, so that's how you do it. I'll show you from the side. How does it look? Inhale, exhaling. 1, 2, 3. Push your hands, elbows outside, back straight. Stay there. 1, 2, 3, 4, 5, 6. Push yourself up slowly. 1, 2, 3. and relax. Okay, so this kind of movement will actually activate the right muscles and put less and less strain on the spine. Okay, so let's do it one more round. 2.5 foot distance between the feet, 45 degrees feet turned outside. And let's do it once again. Inhale and exhaling. 1, 2, 3. Stay there with normal breathing. 1, 2, 3, 4, 5, 6. Slowly push yourself up. 1, 2, 3. All right. So this was Malasana. Now let's go on for sitting asanas. So we're going to sit first in one of the asanas that is actually beneficial for the digestive tract. That is Vajrasana. Okay. So how do you sit in Vajrasana? Fold your knees, keep your great toe together and heels apart, and sit in the V that is formed by them. Okay, so this is Vajrasana. I think this is the only asana that can be done post meals. Okay, so this can be safely done post meals. Rest, whatever asanas we are doing, we need to have some gap of time between the food and performing the asanas. Okay, so at least 2 to 3 hours should be the time gap between meal and performing these asanas. Okay, so this is Vajrasana. Okay, you can always practice this after meals because this puts the digestive tract in a very good position for digestion. Okay, so that's why it's a very good asana that will aid in our digestive process. Okay, so you can always practice this Vajrasana after meals. You can sit in this position initially, maybe starting with about 2 to 3 minutes, gradually progressing it to 5 minutes. Okay, 5 to 10 minutes, you can take it till that time. All right, so that's how you can practice Vajrasana. Okay, now let's see some of the asanas that are going to directly activate the core. So we're going to sit in Dandasana first. Anything that makes your spine erect, okay, that's going to be really beneficial. All right, so keep your legs straight, keep your back straight, okay, and try to maintain a very erect posture of the spine. This is going to actually activate your thigh muscles, your core muscles, okay? Just to keep the spine erect in this position is not very easy, and that's why it can actually activate the core muscles as well. Okay, stay there. 1, 2, 3, 4, 5, 6, and slowly relax. You can fold your legs to ease your back. Okay, so that's how you can maintain this position. Okay, we are going to do this once again. Back straight. Stay there. 1, 2, 3, 4, 5, 6, and slowly relax and fold your legs. Okay, once again. Back straight, legs straight. Stay there. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, so a very simple asana. It's going to make your posture better. It's going to activate your core muscles. So it's a very effective pose to perform on a regular basis. It might look very simple, but it is very effective. Okay, so now let's go on to the other pose. That is a twisting pose. Twisting is equally important whenever you want to target the core area and the abdominal area. Okay, so this is Ardha Matsendra Asana. Again, if you are having any hernia, slip disc, okay, if you are suffering from any abdominal surgery you had or a spine surgery, please do not perform this asana. Okay, so how do you do this Ardha Matsendra Asana? Is you keep your legs straight. First, you just bend one knee, fold one of the legs, bring the ankle towards the opposite hip, keep the other ankle towards the knee. Okay, now slowly you can raise your hand up, grasp your ankle from the inside, and slowly turn behind. Stay there. 1, 2, 3, 4, 5, 6, and slowly relax, and release. Okay, if this seems a little difficult, I'm going to give you an easier version. Okay, so you fold your leg again, keep your ankle like this. I'm going to show it to you how the hand looks from this side. So you raise your hand up, try to keep your elbow inside, hold the ankle, and now try to turn behind and stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. All right, so if this is difficult, if holding the hand like that is difficult, what you can do is you can simply hold the knee like that, okay, and then try to turn. Stay there. 1, 2, 3, 4, 5, 6. Let's repeat it on the other side. Okay, if not possible like that, then you can hold the knee like this and turn behind. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, let's do it once again with breathing. Inhale, exhaling, twist. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Let's repeat it on the other side. Inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right. So this was Ardha Matsyendra Asana. Very effective pose because there is a lot of twisting involved. Okay. So it's going to be very effective for the digestive health. All right. So now let's do some easy twisting as well. Okay. Somebody who's not being able to do Ardha Matsyendra Asana, they can always do the Parvatasana variation. Okay. So what you need to do is sit with your legs crossed, join your hands up, and slowly turn to either sides. Come back to the center. Turn to the other side. Come back to the center and relax. Okay. This is also a twisting. It's also going to activate the core muscles. Okay. So you can also perform this kind of twisting posture. Okay. Let's do it with breathing. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, so this way also our twisting asana can be practiced. Okay, now let's go on to a little bit more core contraction. Okay, that is nothing but naukasana. Okay, again, any hernia, abdominal surgery, okay, any kind of spine surgery, slip disc, you're not going to perform this particular asana. Now let's see how to do naukasana. You're going to keep your legs straight. Initially, if you want, you can perform a variation of naukasana with support. So what you can do is you can lean a little behind and just raise your legs up. You can keep your hands down and stay in this position. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay. Then you can progress on to without support. So you can just lean behind, stay there. 1, 2, 3, 4, 5, 6, and relax and release. Now it's very important while performing naukasana that you're not pushing your head forward like that. Okay, you're supposed to have your head aligned with your spine and stay there. 1, 2, 3, 4, 5, 6, and slowly relax. Okay, so this is how you can do naukasana. It's going to activate a lot of your muscles in the front line. Okay, So it's a very effective asana for core strengthening. All right, so this was some of the asanas that you can do in sitting position. There is one more, that is Mandukasana. Okay, so here there is a lot of abdominal compression that is happening. In this, you sit in Vajrasana. So Vajrasana not to be done with somebody who is having knee osteoarthritis or knee joint pain or even ankle joint pain. You're not supposed to do Vajrasana. Now what you do is you put your hands in a fist position, Brahma Mudra. Keep your hands just below the navels. So your knuckles or fingers are touching each other, and slowly bend down forward. Try to touch your head on the ground. 1, 2, 3, 4, 5, 6. Slowly come back up. In this particular mudra, there is a lot of compression of the abdomen. Somebody who is suffering with GERD, okay, if there is a reflux, it's not recommended to perform this particular asana. Or excessive acidity issues, please do not perform this particular asana. But otherwise, it's a very good compression for the abdomen. Okay. When you go down, you can stay there in normal breathing. I'm not going to count this time. Let's see without, you can just count it in your mind, okay, and stay in that position. So keep your hands in Brahma Mudra below the navel. Inhale, exhaling, bend forward. Stay there with normal breathing. 1, and slowly come back. All right. So this is Mandukasana. It gives a lot of abdominal compression and a very good asana to practice. Okay. So this is one. Now we'll go for some lying down poses. Okay. So we need to lie down on our side and then on our back. Okay. So the first posture that we are going to do is Pavan Muktasana. Okay, again for the digestive tract, very effective pose, especially for people who have a lot of bloating and flatulence. Okay, so first what we're going to do is inhale and exhaling. Bend the knee, bring it to the abdomen and stay there. 1, 2, 3, 4, 5, 6. Inhaling down. Inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Now let's do it with both the legs. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Once again, exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. One last time. Inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, now what we are going to do is we are going to do some lower abdominal activation. Okay, so what we are going to do is we're going to keep our hand below the hip area, just in the lower back and the hip area where the lower back is there and the hip. Okay, so we're going to keep it in that area. Now slowly inhale and exhale and lift both your legs up and stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, we're going to repeat this again. Inhale and exhaling. Lift. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Slowly. 1, 2, 3. So since most of the times we are in standing position, okay, so most of the times this inversion is never practiced, okay. So it's a very good thing to practice inversions, especially for your lower abdominal tone, okay. It will really help in toning the lower abdominal muscles. Let's do it once again. Inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Slowly. 1, 2, 3. All right. So this was about the lower abdominal activation. Now let's do something for the sides as well. Okay. So very simple asana. What you can do is you can stretch your hands up and slowly make a C on the side. Stay there. 1, 2, 3, 4, 5, 6. Slowly come back to the center and do it on the other side. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back to the center. Okay, once again, towards the sides. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back to the center. 1, 2, 3. To the other side. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back to the center. 1, 2, 3. And slowly relax. Okay. So very simple supported pose, which is going to activate the sides as well as stretch the opposite side. Now let's go on for Bhujangasana. Okay. Another asana that is going to help in compressing the abdomen. Okay. So what we are going to do is lie down on our abdomen. Keep the feet together. Keep your hands beside your chest, forehead on the ground. Now inhale, lift yourself up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Let's repeat it once again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One last time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. And you can relax in Makarasana. Okay. It's a good idea to also bend the knees like this in this position. Okay, as it's going to create some stretch on the front thigh muscles, okay, which are also very closely connected to the abdominal muscles. So it's a good idea to maintain their flexibility on a regular basis. So you can always do this particular exercise maybe 5 to 7 times. All right, so that was about it. Now let's do one pranayam, that is pranayam number 4. Okay, vagus nerve activation through diaphragmatic breathing. So something for relaxation, as I already said. Okay, so what you're going to do is keep your knees together, feet apart. Keep one hand just below the rib cage on the abdomen, other hand on the ground. Now inhale and exhale. As you inhale, Your abdomen should rise. As you exhale, your abdomen should go down. So inhale, 1, 2, 3. Exhale, 1, 2, 3. 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 Breathe normal. Slowly, you can turn on your side and get up with support. All right, so this was diaphragmatic breathing exercise, okay, which is going to be very effective for relaxation of the abdominal muscles. So it's good to practice on a regular basis, but do not exceed 30 rounds, okay. Try to do about 10 to 15 rounds in one go in the beginning, okay, with a regular rhythmic counting. All right, let's see. I would like to give you a task of the week. That is nothing but you are supposed to perform Vajrasan after meals, okay, for about 2 minutes or so, okay, on a regular basis, and observe how you're feeling after having the meals. Okay, so how you can document it, you can click a picture of it and upload it on Instagram and tag Times Health Plus. Also, do follow Times Health Plus on their YouTube and Instagram channels. All right. So this was it for today. I have some questions. Let me quickly answer that. So Padmaji says, I work on laptop for 3 to 4 hours. Apart from that, only household chores. Okay, so Padmaji, it becomes very important to ergonomically position yourself correctly whenever you're working on the laptop. Okay, so you need to make sure that your wrists are well supported and probably your keyboard is aligned properly, or maybe sometimes angulation is very good. If you can angulate the keyboard a little bit and then work on it, okay, that might really help in reducing the strain on your wrist and fingers. Also, taking adequate breaks between these 3 to 5 hours is very, very important. Household chores also, okay, so if you are having very thin handled objects, probably that can lead to a lot of strain on the finger muscles. So probably a little broader handle also helps. So these are some of the simple tips and tricks, okay. But if you have decurvance, it needs to be evaluated properly. Okay, if there is swelling, probably we need to check that, okay, how exactly it is, and then probably we can suggest something related to it. Okay, so that needs to be assessed. So it's good to consult a professional like an orthopedic or a physiotherapist to get this addressed at the earliest. Okay, so that's about it. We have some wrist and hand videos as well previously. You can probably refer to that. Okay, so there are some simple exercises given in that. You can refer to that. All right. Sandhya ji, good morning. And I think Vajrasana, I have already answered about the joint pain. If you have knee joint or ankle joint pain, you're not supposed to perform Vajrasana. All right. So that was it for today. I hope you're going to practice all these asanas, which are going to actually contract your core and activate them, and also practice relaxation along with it. Okay. And then get back to me with what are the results that you are getting. I'll see you next time. Till then, make sure you stay present, move gently, and take care of yourself. Thank you and namaste.